So when a patient comes into your exam room, you kind of understand what they're going through.
Definitely my ACL patients, I understand. They're dying to get back out there and it's killing them and you can see it in their eyes. Still remember all that like it was yesterday.
What was it like working with professional athletes? It's got to be a high pressure situation.
An ACL in a professional athlete still gets treated the same exact way as an ACL in here.
So from pharmacy to physical therapy to your PA, do you feel like you're a part of a team?
Yeah, I mean, that's a huge component. We try to offer every aspect in recovery.
All right, so if the Texans play the New Orleans Saints, who you got? All right, Dr. Hunter Berry. Arthroscopy? Is it arthroscopy or arthroscopy?
It's arthroscopy.
Okay. See, I win that bet. Dave, you owe me $50. All right, and sports medicine. How are you today, sir?
Pretty good. How are you?
I'm great.
Good.
I'm great.
Good.
I'm great. I'm happy to be here because I want to find out. About you. First things first. How'd you get into medicine?
Yeah. So I grew up in a small town in southwest Mississippi called Centerville. It's about the size of this room, real tiny. And honestly, my dad was an insurance agent, and I really had no desire to follow those footsteps. I didn't want to be sitting on Main Street and selling insurance. Just didn't seem to be a good fit for me. So, real small community, but it actually has a small community hospital there, and it's the only one in 2 counties. And the guy that, or the family that started that hospital, were very involved in the community and very involved in my life, and sat behind them in the pew in church growing up all my life, and was just very influential in kind of my development, and really piqued my interest in medicine. And it's something that I developed more of a kind of an interest and passion for as I got older, and that definitely helped me kind of direct my path to pursuing that.
Well, how'd you get into sports medicine too? Like, were you an athlete growing up? Is that something that interested you?
Defined loosely, I guess. So in small towns, everybody plays sports, and there's nothing else to do but play sports, and that's great because I get to take care of a lot of those people now, and so I can relate to that being your life when you're 16 years old, and there's nothing else you want to do but play sports all year round. And I think it's a great thing for growing up. It's a great thing for development and learning how to play on teams and teammates, and it's just a really good aspect that I think carries way into your development in life and as you grow up. But I played sports, and I think what got me really pointed towards orthopedics is because I actually did have an injury when I was in high school, and I had a couple of knee surgeries that resulted in long stints of rehab, and kind of made me sit out playing for a while, and made me reevaluate that there was other things in life that other than sports that I had to consider, and basically learn a lot through that, and a lot of patience and rehab, and kind of recover and try to get back to playing sports and enjoying that again. So yeah, definitely had a personal experience with it, and exposed me to a possibility that there was a kind of a really neat integrated discipline of being a doctor and learning medicine and providing a service that really curtails through an athlete or somebody that has that kind of injury.
So when a patient comes into your exam room, you kind of understand what they're going through.
Yeah, exactly. I definitely have probably the most empathy for knee patients. Definitely my ACL patients. I understand everything that's going on in their mind, from the initial diagnosis to hey, we're 4 months. Are we ready to go back to play? And they're dying to get back out there, and it's killing them, and you can see it in their eyes. I still remember all that like it was yesterday, and so that part has not left me. I'm and that helps. I think it helps me kind of identify some areas that are challenges that this injury or this kind of recovery experiences. So that definitely, having that personal aspect, I think, really makes a difference when you're taking care of somebody.
It's funny how those kind of struggles in your past can really benefit you in the future and help you connect with people too. You know?
Yeah, absolutely. Yeah, I mean, that's the main thing, is you want to be able to, you have to be able to connect with a patient. And that's probably sometimes the biggest challenge, is trying to understand where they're coming from, maybe from a different background, maybe have an odd injury, different work situation, home environment, upbringing. And the main thing is you're taking care of the injury, but you got to remember that it's a person as well, and there's other factors that play into people when they come in here. It's not just their shoulders hurt. There's maybe some situations that involve that, and you got to really sometimes break that down and try to find out, okay, well, why aren't we getting as far along as we need to? Is there something else going on? Is there something that's impeding? So there's definitely more a kind of a multi-discipline approach to some of these injuries and recoveries. I mean, sometimes, but on other situations, it's just sometimes it's pretty straightforward. As I fell, I broke it, and what do I do from now? So
you studied. Where'd you go to college?
I went to Mississippi State.
Okay.
Then I went to UMC in Jackson. Was there for med school, and then I did residency for 5 years, orthopedic surgery residency for 5 years in Jackson, and then I did a fellowship in sports medicine, arthroscopy in Houston, Texas.
Okay, and then you were involved with the NFL somehow, right?
Yeah, so in Houston, I was an assistant team physician for the teams that my fellowship covered, which included the Texans, the Rockets, Astros, the MLS team, the several of the colleges in the area, University of Houston. So yeah, it was, and then large, 6A Texas high school football teams that we took care of as well. So a lot of sports coverage, a lot of sports teams, and Texas, everything's bigger in Texas, and I would say that's probably pretty accurate. So.
Well, we talked about you connecting with your patients here, but what was it like working with professional athletes where an injury means like, I can't work, or I can't. I mean, that could mean the same for anyone, but especially with professional athletes, the stakes are so high. It's got to be a high pressure situation.
Yeah, it's definitely, it's a little bit, I mean, in some ways it's different. It's involves their livelihood if you're talking about professionals, and they approach it in that way, and so they understand that their recovery and their success from recovery, from recovering from an injury, it heavily relies on their future. So especially if it's a younger player that may not have that may be trying to earn a spot or trying to establish themselves as a professional athlete, it can be pretty detrimental, and that might change their whole course of their occupation. So it's definitely something that requires probably on their end and the physician's end, it requires maybe more involvement, because you're not usually just discussing these things with the patient, which is the player, and the doctor. It's usually patient, player, trainer, their agent. There's definitely a lot of other components involved. So it's a more complex issue that can make it more time consuming. But in the same sense, the injury is still the same as an ACL in a professional athlete still gets treated the same exact way as an ACL in here. I mean, it's the same approach, same techniques, it's the same new methods or the new innovation or things that are coming out. We're doing the same exact thing as we're doing in the professional athlete as we do with my patient in here, as the high school kid from down the street.
And you're still invested the same way you would be in a player who is an investment, right? Professional athlete, that's why you talk about there's lots of cooks in the kitchen, really worried because there's a lot of money in that. But then when you're here at Southern Bone and Joint, you have the ability to afford the same amount of care.
Yeah, it's the same. It's in some ways, it's the athlete has a lot of people in their corner. They have a lot of people that help them do the things they need to do. It takes more than just the patient a lot of times. There's definitely a team approach, and that's what's important, is making sure that the patient, their family, and then the the providers that are assisting in the recovery are all on the same page. The therapist, coaches, trainers, all those really need to be kind of in sync in order for the patient to ultimately have the best outcome.
What do you actually deal with the most? Like, what's the most common injury that you see?
Yeah, I mean, sports medicine is kind of a misnomer. It's because a lot of times it's not a sports injury. I mean, you can look at any day in clinic, and a lot of times my patients are maybe somebody that's a weekend warrior that was working out and had an injury, but a lot of times it's, hey, I was hanging Christmas decorations and I fell off the ladder and now I've torn up my knee, or I was out in the yard and cutting hedges and I stepped in a hole. And so it a lot of times really has nothing to do with sports at all. It has to do with basically somebody that has an injury, and you're basically trying to get them back to a pre-injury condition. So, but a lot of my injuries that I see typically in here, a lot of them are acute. So it's knee injuries, shoulder injuries, hip injuries, and then we'll see all orthopedic surgeons, especially here at Southern Bone Joint. We'll see a variety of everything. And the great thing about this group is we have a specialist in every category that orthopedic surgery has, just about, and we're able to take care of the patient from really any perspective, from a comprehensive approach.
Now, avoiding injury is ideal, right? But say I get injured, say I do my ACL. What kind of advice would you give me, like heading into the process? Because it can be daunting, it can be scary, even like just to get it fixed, but then the recovery on the back end is extensive with an ACL. So what would you tell a patient?
Yeah, I mean, I think the more information you can give somebody, the better. So if they know going into it that it's going to be a lengthy process, it's a lot easier to have that conversation beforehand than you do have it afterwards. Patients in general don't like to be surprised with things that they weren't expecting. If you know those things are coming, if those challenges are going to be faced or potentially faced, I think most of them like to know that ahead of time. So I think if you can get on the same page and that they know that you're going to be seeing them for X amount of months, and that you are going to be with them in this process for that long, and that's the typical requirement to get them to the best point that they need to be, or to the best chance they have for recovery, I think that makes it a lot better. And so, if it's a lengthy surgery, or if it's a lengthy procedure in rehab, they want to know how long it's going to be. And so you kind of have to talk in generalities. You can't always be very specific, but you can say, look, you're going to probably be this point, this far along, and you might be 75% here, and but we're probably not going to be able to get back to playing full speed until this month and this particular time frame, and that helps. I mean, it still doesn't mean that they don't come in the next visit and ask the same thing, hoping that you may change your mind. But it's then that's the toughest thing. You want them to get better, you want them to succeed, and you want them to be able to go back and play as soon as they can, or do whatever that they're wanting to do, their activities. But in a way, I guess it's kind of like a parent. I mean, in a way, what's best for them, best for their injury, even though you want to kind of give into it, but you have to stay pretty firm and give them the best chance for that recovery to be successful.
And it sounds like a huge challenge just to manage expectations, and you got to be honest, but at the same time, it's hard to deliver news that's maybe less than exciting.
Right. Yeah. I mean, that's what we do in here. I mean, there's a lot of times where, I mean, I spend my day giving a lot of news that's not that's less than popular. But if I can provide a solution to that, I think that's that's where we can kind of come together and move forward to take care of it. Which is that's what I like about this job, is that from orthopedics, it's very hands-on. There's a lot of immediate gratification. Patient may not always feel that way when they're recovering from a surgery that might take 3 months, but and as I get older, I realize that 3 months is really not. It goes by pretty quick. I look up and the patient's already gone through 3 months of recovery, and they're healed, and they're doing well, and that makes it gratifying. It's definitely a big benefit of being an orthopedic surgeon.
So from pharmacy to physical therapy to your PA, do you feel like you're a part of a team?
Yeah, I mean that's a huge component. We try to offer every aspect in recovery and try to make it in one area, in one source that we can make things easier, because it's the small things that make things, I think, more complicated. I mean, in that if you have to have a surgery and then drive somewhere else to get a brace, and then someone has to go get your medicines in another town. Like I mean, I grew up in a small town. Pharmacy was only 5 days a week, and it didn't open past 4 o'clock. So I mean, if it's late and they needed medicine, then they'd have to drive to 30 miles to the next town for that. So we try to provide that in therapy, the same aspect. I mean, everything we can try to give the patient to be the most successful. I think we have that here and can provide that for them.
Yeah, and keeps everybody on the same page as
Right.
well. All right, so if the Texans play the New Orleans Saints, who you got?
Well, when I was covering the Texans, I would say the Texans, but now I'm back in Mississippi, so I can't say that. I can't say that anymore. I have to root for the home team, even though growing up the Saints were the home team, and they're a lot better now than they were when I was growing up. Let's put it that way. I remember the bags on the head and yeah, it's funny, but I did go. My wife's a huge Dak Prescott fan, and so even while I was covering the Texans, she was definitely more interested in going to see the Cowboys, which were 3 hours away. So we do still like the Cowboys.
Yeah, well, it's the state, that link. I get that. You never let that go.
Yeah, I can't quite, but yeah, I mean we still pull for the Saints when we can.
That's good stuff. Well, hey, thanks so much for sitting down with me. This was great.
Appreciate it. Thanks a lot. Yeah, I enjoyed it.